one of the big thing is suture, and everybody talks about suture and how suture would be great. And suture is useful in the OR because I mean, you know, when you're reopen someone, you need to reclose them and have everything proper. But most, for example, laceration on their arms and everything, and I have one. Let's see if you guys can really see what, but I have one scar over here. I was rollerblading and I kind of fell down and kind of big gash, kind of right over here. So it's kind of right over here, and as you can see, I mean, it doesn't show much. I mean, you don't really see it, and never got sutured. All I treated it was with dressings and proper wound care and stuff. So a lot of time, all that suture does is aesthetic. So that means like you close it for the aesthetic of it, but the the wound himself can close himself with proper dressing, and when we do the special on dressing, that's what you're going to see. And so there's kind of two thing when you talk about wound. There's wound management and wound closure. And suture gets into wound closure, so you're closing the wound, but the wound itself is going to heal by itself. And a lot of time you could do that with dressings. So right there already suture is not necessary. Sometimes it will, like if you have a big kind of a bleed, sometimes it can decrease the bleed as well, especially in the scalps where it's very vascularized. But instead of suture, staple would be much better for that kind of stuff, because first of all, it's less of a technique to learn, much easier to use, and very easy to carry. And I'll put a picture of what a staple looks like. So staple, very useful for that. And so I would go way more with suture, especially for people that are not medically trained to instead of suture. The next one is dressings. A lot of people, you see, they like, oh, buy the big bulk of 4x4s and everything, and good. But the problem is that there's dressing sometime, and you can make, depending of how exudates or how much stuff is coming out of those dressings, it won't be that thick, because that's how much stuff will come out, right? It's like a sponge, and so you're losing fluid from your wound. Well, something need to absorb it. Imagine that you have to do a dressing about that thick. So now all this is 4x4s, okay, or pads or whatever you want to do, and you have to change that 2 or 3 times a day for 2 or 3 weeks. And plus, and you'll see in the thing on the wounds that those kind of dressing takes longer time of healing than the dressings that we'll be talking about because of that. Well, now, that's a lot of 4x4s. And this is, we're talking about one wound here. So if you have someone that has, like, you know, a big burn on their chest or something like this, or they burn their arm, we're talking about a lot of dressing here. And so not that easy to carry that much supplies. So so it's to think about to have this. And so I think for me, so far what I'm thinking about more is to carry to something that I could reuse instead of use and dispense. So for example, I know in the 50s when I was in London, it was a tour of I did a tour of an old first aid, well, they called it first aid, but it was like an old army base first aid where they had like surgery and stuff like that, and they were using cotton dressing. Well, cotton dressing, now you could probably re-sterilize that, clean that maybe by cleaning it and reuse it somehow. So so that's more the part that I'm kind of looking at, more using something that you could reuse, re-sterilize with either by heat or by with not a slow cooker, but a pressure cooker. And so, and actually, I'm probably going to do a little video. I'm waiting to buy my my cooker and thinking about doing a little video on that. But that would be more my way of going, or the dressing that we're going to be talking, where it's like it's one dressing stays on for weeks and weeks on end, and your healing gets done. But now it's like one dressing. Yes, they're more expensive, but think about that. Is that yes on the cost, but if you think that you can get away with that much 4x4s for your supplies, that will last you maybe a week, not even. So if you have a moderate exudate dressing to do, because you'll have to do them 2 or 3 times a day, change that, throw those, not being able to reuse them. So wound management, I'm not closure, I really ought to talk about wound closure. Wound management, you have to start thinking about what could I reuse, what could I use stuff that and I think that would be the more proper way than just thinking about putting gauze and cleans and stuff. And I don't think in a situation where supplies are limited, things are done. Anyway, so that was my little bit rant opinion slash what I believe of medicine and scenario where things collapse. I'll put a link for a different course, because I think also the knowledge that you're going to get is very important. So like I said, I think before, in that kind of scenarios, at least have if you're you want to really true prepare, like, if you want one of those survivalists that, or whatever you guys want to, Pussy wants to call yourself. I think if you truly want to be prepared for those kind of scenarios, at least EMT levels, emergency medical technician, because at least the knowledge that they have at that point is pretty good. And even before that, I would put a wilderness emergency medical technician. And the reason why the wilderness medical technician is that you kind of have you kind of get the improvised part of it, and you learn how to do stuff without a lot of gear, which is a good wilderness medicine for that. But even that, it wouldn't prepare you for the whole scenario, because even in those scenarios, you're always trying to prepare. Disaster medicine would be probably closer to those scenarios than any other, even combat course would kind of be on this limitation, because usually it's stabilization, and then you try to bring them to a more to try to bring them somewhere else. And versus disaster, you're dealing a little bit more with prolonged, not enough of resource and everything. But again, there's no course of like what to do if there's no hospital that existed for the next year or so. So that would be very hard to prepare, but unless you do some preparations. But that would be a pretty good start. And I'll put a bunch of links downstairs on courses and stuff that I kind of recommend, or that you should be thinking of. And even one more thing would be to practice. And so there's a lot of places that you can be like a volunteer EMT, and that would be an awesome practice. Not only that it practice your skills, but also your mentality of how to deal with stress situation and taking hard decisions in situation of life and death, which at the end, that's what it comes, because you can have all the training that you want, read all the books that you want, but if you get tunnel visions because you never saw a limb or an arm decapitated, or someone decapitated, or arm cut down and stuff, then you're going to lose all the knowledge that you have. So thank you for watching, and I'll talk to you soon.